This week I want to talk about patient transportation from the front desk back to the adjusting room. There used to be a time in years past when you could use a travel card and you would use that for your documentation, your notes, and that would suffice. Now there are some travel cards that still do work for that, but for the most part with documentation requirements, a travel card is no longer enough. However, we do recommend that you still use a travel card, but you use a travel card for transportation purposes only. In other words, for the purpose of getting the patient from the front desk back to the adjusting room. If you have a CA guiding the patient and putting them in rooms, that's a waste of time and a waste of effort and a waste of money. You want to make sure that the patient is guiding themselves to the adjusting room. Now keep in mind, I'm not talking about the first visit. I'm not talking about the second visit. I'm talking about once they're under schedule, they understand the process, etc. So you do want to have a travel card. You want to have the patient's name on it. Again, this is not necessarily for documentation. It's just to get them to a room. Second of all, you need to have some sort of a clip system. This is basic, but this basic procedure has worked for many years and still works. It's simple, it's low cost. No reason to spend zillions of dollars on this. So you have your travel cards at the front with the patient's name on it. Then you have clips. Alligator clips that correspond with each adjusting room. So let's say the patient's in room 1. Your front desk CA says, "Mr. Jones, you're in room 1," puts the clip on the outside of that travel card and hands it to the patient. The patient walks down the hallway, puts the clip on the outside on a magnet or in a file folder or whatever on the outside of the door, puts that there. So when you walk by, you know, okay, there's a patient, Mr. Jones, in room 1. Your front desk person knows that room 1 is occupied. When you're done adjusting the patient, then you say, "Mr. Jones, give this to Susie at the front desk." He takes it back to the front desk and hands it to them. That way the CA will know that that room is open and the patient can transport themselves back and forth to the adjusting rooms. So this week, think travel cards.